A woman cannot use implants on her own. She needs to go to the service provider or to the hospital for it to be provided for her. Once it's inserted, you can forget about it, and as long as it's not out of the body or it's not causing any complications, most likely it will not make you get pregnant. That's why it's termed as forgettable, because once it's inserted, you just go about your activities and forget that you are trying not to get pregnant. One of the side effects are the irregular bleeding, especially in the first 3 to 6 months of getting these implants. They may get some irregular bleeding, infrequent, sometimes light, sometimes heavy bleeding. But after about 6 months, when your body gets used to it, most women do not have their bleeding afterwards. What does it do? It prevents the woman from getting ovulation. If you do not ovulate, then no egg is released for you to get pregnant. The secondary thing is that it thickens the cervical mucus so that the sperm is not able to swim up to meet the egg. If it's used very well and correctly, about 1 out of 1,000 women will get pregnant within a year. There are several forms. We have the Jadel, we have Implanon NXT, and then we have the Levoplant. If a woman who takes it is a little on the heavy side, sometimes it may affect their effectiveness, so it may not last up to the time that it's supposed to. Let's say if it's supposed to be for 3 years, it may last, let's say, 2.5 years. So for these women, they may have to take it out before the time. I would like to take a few minutes to explain how the procedure is done for these women. After your provider has explained the side effects to you, how it works, and you've chosen this one, they will schedule a time that you would come for the implants. The provider will take you to a comfortable room. You lie down in a comfortable way, and then depending on which hand is dominant, they would turn your hand this way, inside out, and then clean the place where the insertion is going to be done. An injection will be given there to numb the place. It contains an anesthetic agent so that it will numb the place. Then afterwards, the provider will locate the area that they are going to put the implants in, and then push the implants into the skin. Afterwards, they would put a plaster around the area. You're supposed to keep the plaster for about 3 to 5 days, after which you take it off. When you go home, after the anesthesia has worn off, you may feel a little bit of pain around the site of insertion. It is normal. But if you realize that the pain is getting too much, or you're not able to use the arm, you would need to come back for the provider to look at it for you. If you realize that you're having any discharge, you may need to come back. Or you're having any other side effects that you don't think it's normal for you, you would need to come back for the provider to look at it. After about 5 days, 3 to 5 days, you can take the plaster off and then continue your normal activities. Some of the side effects of these implants are just like for the hormones. Irregular bleeding. Sometimes you may not bleed at all. Sometimes you may have lighter bleeding. Sometimes you may bleed for a little bit longer than normal. But they are all parts of the side effect, and it is not dangerous or going to harm you in any way. After some time, let's say after about 6 months of the implants being in, your bleeding may stop altogether, and it is also very normal. The blood is not collecting in your uterus. It's just a part of the side effects of the drug.